Before we dive in, today's episode of Medical Mysteries is sponsored by Organizer. Tired of your time management being unorganized? Organizer reminds us that while they unfortunately cannot rearrange your organs, they can keep your schedule organized. With Organizer, at least the outside of your life can be in order, even if your organs are not. Try it today.
Alright, let's get started.
Welcome back to Medical Mysteries, the show where we dive into the strangest and rarest medical conditions. Today, we're tackling a condition that flips everything you thought you knew about anatomy right on its head: Situs Inversus totalis. Ever heard of someone with a heart on the right side instead of the left? That's just the start. Joining us today are three specialists in the field to help unravel this medical mystery.
That's right. Our three guests today are Dr. Patrick, a cardiac surgeon, Dr. Strand, a gastroenterologist, and Dr. Van Voorens, a specialist in radiology. Thank you all for joining us today.
Thanks for having us. Situs Inversus is such a fascinating condition to discuss.
Let's start with the basics then, Dr. Strand. Could you tell us exactly what Situs Inversus totalis is?
Of course. According to the Cleveland Clinic, Situs Inversus totalis is a rare congenital condition in which all of a person's visceral organs, meaning the heart, liver, stomach, intestines, and even some of the smaller structures, are reversed or mirrored from their normal positions. Normally, our organs will follow a pretty predictable pattern: the heart on the left, liver on the right, and so on. But in Situs Inversus, it's as if they're all flipped around.
Wow, so it sounds like the body's been put together backwards? How common is this, Dr. Van Voorens?
It's actually extremely rare. A study by Eitler and others in 2022 on Situs Inversus totalis found that the condition is estimated to occur in about 1 in 10,000 people. What's even more interesting is that for most people with the condition, it doesn't even cause any health issues at all. Their organs work just as well in the reverse positions as they would in the standard orientation.
So, for the average person with Situs Inversus totalis, there might be no symptoms or even any awareness that their insides are backwards?
Exactly. Most people with Situs Inversus go their whole lives without even knowing they have it. It's often only discovered incidentally, like during a scan or for something completely unrelated.
That's incredible. Dr. Patrick, have you ever operated on someone with Situs Inversus?
Yes, actually. A few years ago, I had a patient with Situs Inversus who needed surgery on their appendix, which, as you might imagine, is on the left side in their case, not the usual right.
Wait, so that must make things complicated. How do you even begin to adjust for something like that during surgery?
Well, it requires a lot of extra planning, that's for sure. Before surgery, we rely heavily on imaging, like CT scans and x-rays, to make sure absolutely everything is certain of the patient's organ layout. The reverse anatomy can make navigation during surgery challenging, especially in cases involving the heart or the liver. A case study analyzed by Dr. Sun and others in 2023 of a 39-year-old man showed that in cases where these patients needed surgery, the provider spent a good amount of time reviewing the scans and mentally preparing for what felt like doing surgery in a mirror.
Can you imagine how many times surgeons just expect things to be in the standard places? Dr. Strand, have you ever had cases like this as a gastroenterologist?
Definitely. I had a patient with Situs Inversus who came in for what they thought was heartburn. Their pain was actually on the right side, which led us to realize that they had appendicitis. Diagnosing issues in patients with Situs Inversus is tricky, but you always just have to keep the flipped anatomy in mind.
It's fascinating. The body works as if nothing's out of the ordinary, but it's like a mirror image. Dr. Van Voorens, from a radiology perspective, what challenges come up in diagnosing patients with Situs Inversus?
Imaging plays a crucial role in these cases. If we aren't aware that the patient has Situs Inversus, it can lead to misinterpretation of the scans. Imagine seeing a CT scan with someone's chest and you spot the heart on the right. If you don't know about the condition, it's easy to make a mistake and think it's something else, like a congenital heart defect.
So it sounds like something that could lead to a lot of confusion if not identified early on. Do patients with Situs Inversus ever have associated health problems?
Most don't, but according to a study conducted by Peters and others in 2016, there's a subset of patients with a condition called Cartaginer syndrome, which is sometimes seen in people with Situs Inversus. It's a rare genetic disorder that can lead to respiratory issues because of problems with cilia in the lungs.
Okay, so it's rare, but some may have additional health complications. Is there any cure or treatment for situs inversus itself?
No, there's no cure because it's not exactly a harmful condition in most cases, unless they have complications from something like Cartageners. According to Adler and others in their study published in around 2017, patients with situs inversus usually don't need any treatment. They just have to make sure that any healthcare provider they see is aware of their unique anatomy.
That's really good advice. Now, I know we've mentioned that this condition is often discovered by chance, but are there any famous cases of situs inversus?
Yes, an article published by credithealth.com revealed that actress Catherine O'Hara and singer Enrique Iglesias both reportedly have situs inversus. So it really does go to show that people can live completely normal lives without ever being affected by it.
Oh wow, so there are famous people with situs inversus. Very cool. I meant more so, are there any famous case studies in the medical field?
Oh, that's too funny. But definitely. One of the most famous case studies analyzed by Klintman and others in 1993 involved a 35-year-old woman who needed a liver transplant. Because of her situs inversus, her liver was positioned on the left side rather than the right, which made finding a compatible donor liver exceptionally challenging. Surgeons had to carefully plan the transplant, coordinating with specialists across the country to ensure that the new liver would work well in her unique anatomy.
It was groundbreaking. They ultimately used a mirror image liver graft, which was specifically selected and modified to fit her reversed organ placement. It was one of the first cases where a successful liver transplant was performed for someone with situs inversus, and it helped set a precedent for future transplant procedures in these rare cases.
Wow, that's pretty incredible. It sounds like it took immense preparation and teamwork. Cases like that and others really highlight how situs inversus, while often harmless, can actually pose complex challenges during surgery.
Amazing. Before we wrap up, any final thoughts from our experts?
I'd say it's a great reminder of how diverse human anatomy can be. Medicine teaches us so much about what is normal, but situs inversus is a testament to the exceptions that keep us on our toes.
And it's also a reminder to always consider each patient's unique circumstances. Medicine isn't one size fits all.
I agree. In radiology, it's important for us to remain curious and open-minded to all possibilities. It keeps things exciting and challenges us to keep learning.
Thank you to our incredible guests for enlightening us on situs inversus totalis. And thank you, listeners, for tuning in to this episode of Medical Mysteries.
Remember, the human body is full of surprises. Join us next time as we uncover more medical mysteries.